we're going to start getting into the nuts and bolts of sessions and really talking about the skills taught to parents in the context of these sessions. So I want to make sure that we provide appropriate opportunity for you to interface with your colleagues as well as practice how you would introduce some of these skills or use some of these skills with parents. So I'm going to move us around a little bit. You don't have to move if you don't want to, but I'm going to try and match some people up. Is there anyone here who particularly works with an early childhood population? A couple of you?
I work from 0 to 18.
Okay, do you maybe want to come up and join this group then? Any of you, and you're welcome to join as well if you would like to. Anyone works primarily with an adolescent population? A couple of you. So why don't you guys look around? We've got 3 in the back, 1 here, 1 here. So if you guys would like to move to be closer to share ideas, you're welcome to. Ladies, we're starting to kind of move people around. So we've got an early childhood group up here, if that's primarily with whom you work, an adolescent group hanging out somewhere. The other thing I wanted to ask is that some people intend to run primarily groups versus individual sessions. So for those of you that intend to deliver this in primarily a group format, can I see hands of there? Got a grouper? Or someone who plans on doing a group? And then, so I'm assuming the rest of you are intending to run this individually? With individual sessions? Okay. Ish, or maybe a little bit of both. Is there anyone that works with developmental disabilities? Okay, do you guys maybe want to shift together? Okay. Oh, you all by yourself. We're going to move you with a group. Okay. And again, you don't have to work with a group. I just think in terms of professional development and idea generation, working with colleagues who work with similar populations can help for idea generation. So I'll let you guys move. All right, so I wanted to explain how this manual is developed or how it's laid out so you can make some decisions from there. All of the sessions in the manual that I will be giving to you follow the same general format. In the first session, there's a review of homework from the previous session. It then segues into introducing a new skill, then into working with parents on selecting the application of this skill or generating with parents how they're going to use this skill in their home setting. Role playing of the skill with a therapist or other parent. I had been anticipating more, actually I'll come back to that point in a second. Practicing the skill and then planning how they're going to use it in the home context or planning for homework. The way this manual has been written, and again, this is just an adaptation of a generalized behavioral parent training manual. And so I want to be very clear about how it was written so you know how to interpret it and apply it. It was written with the intent of group sessions, and group sessions tend to run a little longer because of navigating multiple people within a group. So the session is written to be around an hour and a half in content. If you are doing it individually, it naturally shortens the length of the session to a more typical outpatient 50-minute model. Though there may be times where you have to strategically decide to shorten a component of the session to fit within your time or to cut the session at a certain point with the intent on picking it back up next time. And I want you to feel as though you have the flexibility to do that. You should have the flexibility to do that as you're getting to know your families. Additionally, for the role play of skill with therapist or other parent, if you'll remember from this morning, one of the essential ingredients was practicing the skill with children in the session if possible. So if many of you intend to do this in an individual session format, you have a more flexibility to bring the child in and have the parent practice with the child in session, and I think that's a great thing. Again, because this manual was written for a group administration process, we have parents practicing with the therapist or with other parents. And that in part was strategically because it would be hard to bring in 25 kids to each practice with their parents in the context of a session and then move them back out. So again, if you're doing this in an individual format and you have the availability of bringing the child in and practicing this skill with the child, the meta-analysis showed that that was a very helpful component. In terms of practicality, there are times where that's not a possibility. The child's not there at session, or there are other constraints which preclude you from doing that, in which case we highly advise that practice in session still occurs either with a co-parent or with another caregiver or with a therapist, because really it appears to be that the active practice of the skill is what produces the largest effect rather than just talking about the skill. So it's important to talk about the skill in terms of understanding it and ensuring that the parents understand it. It's important to talk about the application of it. So how are they going to go home and use it in their context? But if you are going to have to cut down content areas of anything, I would suggest the thing you don't cut down is the active practice of the skill during session, as that appears to be one of the primary agents of change, is that active practice. So when we're going through and practicing these skills here during the workshop, understand that you will be practicing them with your colleagues in this room as though you were either a therapist and a parent or a therapist watching a co-parent. But to the extent that you can plan for kids to come to session and practice that skill in session, that's something I want you to keep in mind, and we can talk about mechanically how to make that happen. Okay, so this is the general framework for each of the sessions. Before moving on, are there questions that you have about the general framework of sessions? Nope. Okay. So some people have asked, are you allowed to have a pre-treatment orientation? And certainly you should feel welcome to have a pre-treatment orientation. And I've outlined some points that you may want to make to parents. We're not going to practice this in session. We're going to instead move into what would be a session 1 of this manual, which is first the introduction of social learning theory. And we are certainly not going to go through each of these points again, as we just spent a long and hopefully lovely morning reviewing all of the components of social learning theory. But this is something that you will be doing for parents to make sure that, if nothing else, they appropriately understand what an antecedent is, what a behavior is, and what a consequence is, and how change happens over time. So again, what I have up here is essentially a checklist for a first session. What I'll be distributing after the break are the actual manuals for you to take home that has this and much more detail than what I have in these slides for you to take home and review and to use. These slides are really, for the purposes of this training, intended to be a snapshot of the different components of that larger manual. Okay? So what you would be going through in the first, and please note here, anywhere I say group session, it's because this was written for group, but structurally it's the same thing if you're doing an individual session. So welcome to the first session. Introduce them to parent training or to parenting class or to parenting support group or whatever it is that you are going to title it. And then we're going to go into a brief description of social learning approach. And didactic means this would be you giving information to the parent, or not lecturing per se, but you imparting information. We're then going to hand out ABC tracking sheets, which I'll be handing out to you in a short moment here, which is essentially a sheet that has ABCs, and parents are going to be learning what an antecedent is, what a behavior is, and what a consequence is. And using this ABC sheet week to week as they learn new skills, they can add it to their behavioral repertoire. You're then going to define antecedents for parents, much like I did with you earlier. Define consequences for parents, much like I did for you earlier. And behavior for parents, much as I did earlier. We're also then going to segue into the importance of tracking behaviors, or having an objective count of when behaviors are occurring, how they're occurring, and how frequently they're occurring. And this is something quite important to impart to parents, because oftentimes, and understandably, parents' perception of the severity of the behavior can be biased by kind of their emotional their level of emotional connectedness to the behavior. So if it's something very distressing to them, it's going to feel a bigger problem. And that's not to minimize the problem to parents, but in terms of understanding, is this behavior being appropriately punished? We have to know, is it really decreasing over time? Is this behavior being reinforced? We must know, is it actually increasing over time? So things that can happen during the week and then in session is, a parent can be appropriately consequating a behavior, and over the week the behavior is declining, but right before session a temper tantrum comes, or an instance of non-compliance occurs, and to the parent it feels very much like, this isn't working, look what I just had to deal with. So teaching parents the value of objectively tracking behavior can help us to determine as professionals and to guide parents, is what we're doing working or is it not working? Then you'll move into having parents identify their child's problem behaviors and writing them down and learning how to essentially create an operational definition of the behavior. So not just my child has a bad attitude, but really defining what are the things that we can work on with the child. We then move into writing down the opposite prosocial behavior. So if your child's doing this and we can objectively identify it, what would be the replacement behavior you'd want to see, or what's the behavior that you would want to see in place of that behavior that exists? We choose the time for the activity, which is essentially planning for the application, and then move into homework. So that's kind of a nutshell overview of what your first session with parents would look like. The goal of this first session being to provide an overview of social learning theory and behavior management principles. Social learning theories include defining behaviors precisely, using consequences, and using antecedents, and then defining a behavior. So this is essentially the major points that you would be relaying to parents, okay? I'm gonna pause here for a second, and I want us to start, much as we emphasize that parents need to practice in session, either with their kids, with their therapist, or with their co-parent, to make sure that they understand the application of this. We're going to do that here in group 2. So because you were all wonderfully brave enough to be the first in our role play, you get to start out with one of the easy ones. And what we're going to do is give you about, now in session you would take much longer to do this than what we're going to do in the role play, but we want to make sure that we give a chance for adequate practice of relaying to parents how to impart what social learning theory is in a way that's going to be amenable for them to hear, easily understandable, digestible. So I want you to take about 2 minutes in your subgroups, and therapists, I want you to practice how you're going to introduce social learning theory to parents. Parents, that's the rest of you. If you have not identified yourself as therapists, you're parents. Your job during this first role play is not to challenge your therapists and throw to have them throw everything out the window, but is for you to be a reflective listener and to turn around when it's done to give your therapist feedback on how they did introducing the concepts of social learning theory. Because the feedback that you're receiving will be valuable in shaping your behavior as a therapist, but then it's also modeling for you as a parent. Okay, so are we clear about our roles for the first one? So parents, you're going to be receiving the information. You can ask questions, but your intent is not to challenge. Therapists, I want you to work through these 4 points. So what is social learning theory? What's a behavior? How will we be using consequences and antecedents that are effective? And then we're going to come back together as a larger group. Are we ready? I'm going to give you the action. Action. Okay, let's come back as a larger group if we can. So, can I see my therapists again by hand? Sorry? Therapists, Liz, and then over here. Okay. So I was just seeing who were my therapists again. So parents in the group, I want you to take a minute to give feedback to your therapist on how they did introducing the concept of social learning theory and working through those points. Now I realize I gave you intentionally a short period of time to get through that, so you would have more time in session to assess for understanding. But I want you to give feedback to your therapist, particularly on the positive things that they did. So anything you felt went particularly well, which would be helpful for parents to hear so that they know what went well. We'll then pause, come back together as a larger group, and then turn and give feedback on what would be helpful information to constructively guide the introduction of this social learning theory to parents. So start first with what you think went well, what was positive, what did they handle well, and then we'll come back as a larger group. All right, let's come back together as a larger group for a moment. So, my question to the larger group now, you've had the opportunity to have social learning theory introduced by a therapist to you, receiving it as parents. Give feedback on what your therapist did well or what were successful strategies they used in imparting that information. I'd like to hear from the larger group of what were some successful strategies your therapist used in giving that information.
I think inclusiveness.
Oh, let me start here. That's okay. Inclusiveness?
Yeah, she included everybody she was a part of, and not the teacher, student, teacher. It was very inclusive.
Okay, so she didn't present herself as, I'm the person who has all of the answers and I'm going to tell you what to do, but more as a partner and going through it. So if you present yourself as a partner with your parent, what message do you think you're sending to them? We're in this together? Okay. Pardon me? You understand? Okay. What did you think went successfully?
Well, she engaged all of us. She was asking questions to see where we were coming from.
Okay, so assessing your knowledge, assessing your understanding. Okay, what were other positive strategies that therapist used? Yes?
Our therapist broke down the idea of social learning for us. You know, as parents, we may not understand the
Sure.
concept, and she made a very good point. You know, this is what we're going to do, and we're going to get through it together. You may not know it now, but I'll teach, you know, we'll
Okay.
work on it together.
So emphasize the togetherness, working together, and also broke it down in an easily consumable way. Okay. Any other points of feedback that would be valuable for the group to hear?
Easily consumable, user-friendly, because there are populations of parents who were antecedent and
Yeah.
a little mind-boggling to them, and so we thought of substitutes for that.
What substitute did you use for antecedent?
What was the setting, what was going on?
Okay, so what was the setting?
So we thought of KISS,
Mm-hmm.
simple student.
Yep, a very good acronym. So keep it simple. So what was the setting or what was the event that was happening? I know earlier you were saying instead of presenting it as reinforcement or punishment, it's, you know, what would be something your child would want relief from was a different way of saying it. All right, what I'd like you to do now is take a quick minute, and then we'll again come back as a larger group and continue to move through the session content. But take a quick minute to give some constructive feedback to your therapist about what they would want to be mindful of or what they can improve upon in introducing social learning theory to parents. Particularly if you work with a group of parents that may be different than what your therapist or whom your therapist is most typically working, that would be an excellent learning opportunity for them to know strategies that you've used that have been helpful. So take a quick minute to give feedback, and then we'll come back together as a larger group. Thank you guys for coming back together. Thanks, this table. All right, so I'd like to hear again from the larger group about what were some points of feedback, and I'll specifically hear from therapists this time. What were some points of feedback that you received that will help you deliver social learning theory better to parents? Sure, thank you.
Yeah, talk about I didn't really focus on or talk about the incremental aspect of learning.
Okay.
And they talked about how that's important, how parents expect instant gratification if you don't get them. And then we talked about ways that I might convey that.
Okay.
And then the other we talked about is that was brought up to me was the cultural differences in watching language, because what you think you're saying and what people are hearing may not be the same thing.
Yeah, very fair point, and hard to receive when that comes to you, particularly with the parents. So being mindful of that ahead of time, I think, is invaluable. The other point that you raised was emphasizing to parents the nature of change or the nature of learning and how it is incremental. And I think you bring up a great point that emphasizing that and re-emphasizing that to parents is a valuable expectation management strategy. Oftentimes, analogies that we'll use in explaining this to parents are, you know, when your child first started walking, you probably encouraged them along the way. So as they moved from crawling to learning to pull themselves up, to taking that first step supported, to taking steps unsupported, you know, you probably, without realizing it, did a lot of positive reinforcement. So you provided a lot of encouraging facial expressions, you were very into the moment with the child, a lot of supportive statements, a lot of patience as they were making change, and your children learned to walk. But that was a very gradual process. We expect it to be a gradual process, so it felt very encouraging to us. Same thing when kids learn to read. They don't go from just learning letters to learning to read. They have to learn to identify sounds, blend them, how to deconstruct them until they can read fluently. So those have been analogies that I have used before in explaining slow change to families, but are there other analogies that therapists have used that you think would be of benefit in explaining change as a slow process? Learning to drive, that's a really great strategy, particularly if you're working with the parent of an adolescent. It might be even some expectation management for learning to drive. Okay, what were some other points of feedback you received as a therapist that you think would be helpful for the larger group to hear?
I just felt that she had a time constraint because we kind of.
Well, sure, I unfairly only gave you a couple minutes.
It's like building rapport and trying to get where we were at, as parents, and tell me what kind of behaviors or how that affects you and the child. So we were just saying that she was trying to make us feel comfortable enough to go to the point of defining behavior antecedents and all that. And then we were also commenting that a lot of our parents aren't gonna antecedent, they're gonna look at you like you're speaking Chinese. So it just like the other person said at the table, what happened before, like what happened before Johnny, picked up the chair, what was going on, and just defining it more concrete for some of the parents that might not be as educated as
Sure.
we're all therapists, so we kind of know the lingo.
Yeah, I think the point you're saying that's really valuable is that this is a new skill that parents are learning. So even just understanding how behaviors are shaped over time is in and of itself a learning experience or a shaping of behavior. And so not expecting parents to get it right away, but building a supportive relationship with them as they make progress in understanding, identifying the process that they're making, acknowledging the process that they're making. So in some respects, you are shaping their behavior to in turn allow them to shape their children's behavior. Okay, so that's one of the major components, whether doing this individually or in group format of the first session, is making sure that parents, whether we're using the words antecedents and consequences or not, that they understand the change process, they understand that what happens before behavior is going to influence behavior, what happens after behavior will also influence that behavior, and that we're trying to set the stage, or trying to set up conditional probabilities to set up the likelihood of the behaviors we want to see happening in the future. We're going to then emphasize to them the importance of defining behaviors and of assessing objectively or tracking those behaviors so we can see, are the plans we're setting up going to change over the time? So the next major activity that you're going to do with parents in session is having them to identify problematic behaviors. Now, as therapists, one thing we have to work with our parents to do is to get them to identify objective behaviors. So not just, gives me flack or has an attitude, but what is it specifically that the kids are doing so we can work on changing those specific behaviors. So that rather than working with one therapist and a group of parents, I'm going to partner us up or work in groups of 3. So can I allow you two to be a natural partner here? And then do you two want to be partners? We'll be a group of 3 here. And I'll have you two be partners. Let's come back together as a larger group. Therapists, what your job is, thank you, I really appreciate that prompting, that cue. Yep. Therapists, what I want you to do is to work through this activity. I want you to introduce to parents the value of identifying a specific behavior. Now, I have labeled it up there a problem behavior. You do not have to label it the same way if you don't want to, but I want you to get parents to identify behaviors that they want to change in their children. And I want you for this exercise to have them limit it to 2. So parents, you're going to be writing down those behaviors. And therapists, I want you to guide them in a supportive way into making those definable, observable behaviors. One thing that's mentioned in the manual that can be a good, useful rule of thumb is that one thing that is difficult for parents is understanding the difference between an observable behavior and a non-observable behavior. So I want you to keep in mind what might be some guiding strategies for gearing parents towards observable, definable behaviors, and also emphasizing the value of that. Parents, rather than just sitting there being therapists, I want you to think about, pretend to be a parent that you've either worked with or a parent perhaps that you are. create a child in your head so that when you're doing this role play with your therapist, you're providing some meaningful context, okay? Any questions about our role play? Yes? No. No. Okay. So we're going to start first and then we'll flip so both people get the chance to, but want to work on identifying 2 observable, definable behaviors. Any questions? All right. Action. All right. So for those of you that were just therapists, what I want you to do is listen to the feedback that your parents are going to give you about how you guided them into defining observable, definable behaviors that we're going to work on changing over the course of our time together. So give your therapist feedback on how they did in guiding you through that. Please make sure to give them points of positive feedback for things that they did well so they know to maintain that in the future, but also please feel free to give them some guidance on how they may have handled that situation better. We'll come back together as a larger group then, share, and then do the role play again, swapping out therapists and parents, okay? Proceed. Thank you guys for quieting down, thank you. All right, so what I'd like to do is hear from some therapists. What were some points of feedback that you were given about how you did in guiding parents to come up with observable, definable behavior that would value the whole group to hear?
You don't want the parent to tell us. The parent should tell us.
You want the parent to tell? All right, parents, what were some pieces of info that you gave to your therapist about what they did well or what they could improve upon? Essentially points of feedback for when they're working with parents directly that you think would benefit the whole group to hear.
I like the taking me from because I use the kid's attitude, bad attitude, taking me to what that looks like. Could you describe it for me? Which got me into without asking me for, give me an observable behavior, which kind of is abstract in our head. That took me right to that. It was a nice incremental thing.
Oh, very nice labeled praise right there. So you're able to say, instead of saying, like, define that for me, give me something objective, saying, I hear what you're saying about attitude, but describe that for me. Tell me what that looks like. I haven't met your son yet, or I don't know your child, so tell me what you're seeing is a good way to guide there. What were other strategies that you thought went well?
I think that relates to what he was saying, and that is that Kathleen had narrowed it down as to how would I know that my son was responding favorably. He wasn't listening, and so how would I know?
And he is listening.
Look at me and acknowledge me. So that gave us something to work with.
So she naturally tied in that next step of what would be the replacement behavior. So helping you to define what's not listening, but then taking the step further and saying, so how do I know when they are listening? Which is essentially that positive or replacement behavior that we want to see. Other strategies that you thought worked well that would benefit the group to hear? Yes.
I gave an example of my son that's not completing homework, and I'm working late. My daughter's in college. She's the one watching him. She's very good as far as taking down and making it very concrete as well, taking down every information at the same time, intercepting with already some suggestions that were triggered in me, responses that I realized, oh, he's also doing this. But then at the same time, she gave really solid suggestions. She was empathetic with the mom, but at the same time gave suggestions as far as doing cooking together, incorporating activities so we have more parent-child interaction, and a schedule. So it was very good.
Wow, she rocked it. Well, it sounds like I'm hearing you say too is that you're able to recognize a more complex behavior like not getting homework done and identify that this is probably a chaining of smaller behaviors together. And so you're able to lead the parent through what are all of those small incremental steps that result in getting homework done and getting her to identify where problematic behaviors might arise. Okay, yes?
I think it was a revelation.
It was a revelation to you?
Total revelation to me, because he basically, in the scenario that I was giving him, it was about my daughter not doing the dishes. And about me really asking Melissa every day, honey, are you going to do the dishes? Basically, he said, he just took me to that place, what does it look like? I said, well, she usually stands up. She goes upstairs. She doesn't come back down. And he says, well, what do you do? And I said, well, I'm getting frustrated and I end up doing the dishes. But he said, what exactly happens before you ask her to do that? And that's where the revelation was, because I said, she usually comes tired one day, and she's just relaxing. And here I come to interrupt her time, really, her relaxation, and she usually doesn't take it well. So maybe that was a modification of my behavior that I needed to look at. Finding an easier time or a better time where she's more rested and more relaxed, and then maybe ask her to do the dishes at that point.
So he helped you to define the behavior, but also started to weave in the antecedents and potentially the consequences of why this behavior might be as it was. So it sounds like having, as a therapist, that ABC model in mind and knowing that our antecedents are going to contribute to the behavior and our consequences are going to modify it. Not only are we doing the service of helping parents to observably and definably identify problem behaviors they want to change, but we're already starting to model and to generate for them what might be contributing to it, what might be happening, what might be maintaining it. Okay, I do want to give the opportunity for us to flip. So when I say flip, I mean if you were the therapist before, I'd like you to be the parent this time. If you were the parent before, I'd like you to be the therapist. If you were in a group of 3, I'll just have you choose one other therapist, because we're going to go through this role play just once more. Now, some of you naturally did this, but what your directions were for last time were to identify the problem behaviors. I want you to go ahead and keep those problem behaviors, but for this role play, I want you to guide on what would be the positive behaviors or what would be the opposite of the problem behavior. If you went ahead and already did that, we'll just do the same scenario all over again. But if you didn't make it to that point, please emphasize guiding parents to what would be the opposite of the problem behavior, and also having them define that observably and objectively. Okay, we'll do this one more time, come back as a large group, and then we're going to finish with questions and already start to move into session 2, okay? So action. So as I realize some of you have started to do this already, which is fantastic, but you were able to role play moving from problem behaviors into the opposite or replacement behaviors that you want parents to also identify and have them be observable, definable behaviors. And I heard several of you starting to give feedback to your therapist on the strategies they used that worked favorably for them, and to give them feedback. If you've not already, and this one's going to be very quick, maybe 30 seconds, please give points of feedback to your therapist on how they did in guiding you to those observable, definable, positive, opposite behaviors. Just about 30 seconds, and then we're going to come back together again. All right, so we have now gone through 2 role plays where you've had the opportunity to be the therapist and then to be the parent, to identify problem behaviors in a definable, observable way, and then to identify opposite or replacement behaviors in a definable, observable way. And you're able to give feedback to your therapist on strategies that they should continue to employ when they're working with parents, and also important pieces of feedback. And you've had the opportunity to get important pieces of feedback and strategies that you should make sure to maintain when working with parents. And we've heard a number of those from the audience, but I want to make sure we don't neglect anyone. Were there other pieces or strategies that people felt it would benefit the larger group to hear? Yes?
I think there was one thing that we did earlier, which was not only defining the behavior in particular, but then also with the setting. So it started out as it happens everywhere kind of description. And so not only narrowing it down to define the behavior, but pick a particular location to work on as opposed to across the board, so that you can get very specific.
So for some parents, it might be overwhelming if it is a behavior that happens so pervasively or chronically to feel like I have to deal with this all the time. So not only did you help them define the behavior, but for some of our parents, it might benefit them to define discrete periods of time where they're going to try to track or notice that behavior, because doing it all the time would be exhausting or too big of a task. So much like we might chunk or create meaningful tasks that kids can do, you're essentially doing that for a parent as well. So offering them a shorter period of time where they could observe or track how frequently is this really happening. So I'm going to pause for a moment. What we've gone through is essentially introducing social learning theory to parents, introducing to parents how to set up definable, observable behaviors, and then also definable, observable opposite behaviors or positive behaviors that we want to see an increase of. So essentially the purpose of this session is to set the stage for the framework that other sessions will follow. What in this class we're going to be moving into is attending and how to teach parents attending skills for their interactions with their child. And again, that's how the manual is set up. But as we go through these, I want you to both think about sessions as a progression of skills that you can learn, but also think about for the particular families with whom you work, if this is in fact the order that you would want to do things, because I do think that there is rationale at times for, inserting a session or changing the order of sessions. So I want you both to think about what would this look like in terms of the progression as it's presented and how you might make modifications for the families with whom you work, because maybe some engagement strategies or different parenting skills might help for some of those families that are feeling either like they're being put upon or that things are so overwhelming for them that they can't seem to catch their breath. So I do wish you to think about those things, and we can also talk about them as a group. What might be order effects that would be helpful for certain families, okay? Before we close out session 1, I just wanted to highlight there are some examples in the manual for you if you want to provide examples for your families. And then also there's an antecedent behavior consequence tracking sheet. Again, this is presented to you for your use, and you can present it to families as ABCs or antecedent behavior consequences. But I think the bigger picture here is as long as you keep this framework, even if you're relabeling it as something else, that's fine as well. What we want parents to get into the habit of is when they're choosing behaviors, to choose behaviors that are definable and observable. And then to the extent you feel your parents are ready or comfortable, to also start guiding them through identifying the antecedents that may precede those behaviors and some of the consequences that may occur after those behaviors. Kind of like the example you mentioned in the back, even though the intent was to help you define not doing the dishes, it sounds like he was able to help define many of those smaller behaviors and also set the stage for what might be an antecedent contributing to it, what might be a consequence contributing to it. So that's something that I'll charge you to decide as you're working with your respective families, whether we want to pause at just defining the behaviors or whether we want to define those behaviors in the context of antecedents and consequences. And then also to charge you with, as you're working with families, whether you want to keep antecedent behavior consequence as the labeling tools for social learning theory, or if you want to come up with a different vernacular or vocabulary for your families. If you come up with a different vocabulary, as long as you're being consistent in your implementation, it shouldn't theoretically change how parents are understanding it and how they're learning. You just want to make sure you keep that framework throughout your time working with the families, okay?